I'm not afraid of death, and here's the science behind it. Our body biologically helps us die. So here is what I've seen and learned as a hospice nurse over the years. Our body is literally built to die. If someone comes on hospice and they're 6 months out from death, their body will start shutting down for them. How does that look? They start eating less and they stop drinking less and they start sleeping more. But why? That is happening because calcium levels in the body are going up. And because calcium levels are going up, the person is getting sleepier. Our brains have built-in mechanisms to make us hungry and thirsty biologically. When the body knows it's getting towards the end of life, those mechanisms shut off. So the person does not usually feel hungry and does not usually feel thirsty, which is helping the body slowly shut down. Our perception of death is always next to or adjacent to the person who actually is in the dying body. So we're seeing what they're going through. And because we're not in a dying body, it can feel really scary. And you must think that must feel bad to sleep all the time, not eat, not drink. They're starting to look different. So it can feel really scary, but we're not in that dying body. When someone is, it's a different shift because it feels natural, or it can feel natural. Now, there are times when the disease that the person is experiencing can cause symptoms, and it is more difficult, right? Because they're dying from a certain disease. But the actual process that the body is going through to help it die is actually helping that person. There have been many times as a hospice nurse that I have watched someone slowly die on hospice and not needing to give them any medication because of that. Their disease was not causing them any symptoms. No pain, no shortness of breath. They were just more tired and not eating and drinking. They still did all of the things any other person on hospice would be doing, like they slowly go unconscious, they slowly stop eating and drinking. I had to give them no medications, and they were perfectly comfortable and died a very peaceful death. So many people think my loved one was unconscious because they gave them so much medication, when in reality, they're probably unconscious because their body is in that dying phase and causing them to slowly go unconscious. Another thing that is still really comforting to me is that when the body really stops eating and drinking, which everyone at the end of life will do, the body slowly goes into something called ketosis, which releases endorphins in that person's body. Those endorphins dull pain, dull nerves, and they also give that person a euphoric sense. So they feel good. There are many reasons why I don't fear death. Yes, I've had some pretty crazy spiritual experiences as a hospice nurse that led me to not fear death, but there are also biological, metabolical, physiological things that happen in the body that truly comforted me watching it as a hospice nurse. Coming from an ICU setting where I was constantly trying to keep people alive, which has its place, of course, and then shifting to hospice where I saw the body die naturally, it was even wild to me as a medical professional what the body can do to help us. And at the end of the day, our bodies are built to die. The less we mess with that, the more peaceful it will be.